telltale signs of this condition is significantly worse at night or early morning. It is triggered by exercise, especially the cold air. Triggered by strong smell, smoke or perfume. It is dry, non-productive cough. What's happening is your airways are twitchy. They are constricting and spasming, and your body's only response is to cough. But what if it's not viral at all? Hidden cause number 4 is bacterial infection, the one antibiotics actually help. The NHS guidance correctly says that most coughs don't need antibiotics, and that's true, most don't. But there is a subset of patients who develop a secondary bacterial infection after their initial viral illness. Bacterial bronchitis, sinusitis, even early pneumonia. The signs that suggest bacterial infection are cough producing thick green or yellow mucus, symptoms that improve then suddenly worsen, persistent fever or fever that returns, feeling progressively worse rather than better.